Hi, hello friends, good morning. Welcome to our channel, The Voice of Nurse. Today we are going to discuss a continuous topic from the previous video from the subject of child health nursing. Now we are going to discuss part 2 from the previous video continuation from the question number 21 to we will continue in this video. In part 1 we already discussed related to the child health nursing introduction, growth and development in children's and what is sick child, disorders and health problems of a child, children with various disorders and diseases. These all things we already discussed in part 1 introduction related to the child health nursing. Apart from this introduction in the child health nursing related, we discussed in the FAQs. In that video part 1 we already discussed 20 questions in part 1. Now we are going to discuss part 2 from the 21 to 50 question we are going to discuss in this video. Before moving on to topic, a small request friends. Anybody here first time watching my channel, please subscribe my channel, click on the bell icon for further notification. Please give a like friends and share your opinion in comment section. And also please share the video to your friends. Next, move on to topic. Today we are going to discuss part 2 from the child health nursing from the 21st question we are going to discuss. The 21st question is inflammation of the eyelids is called as. What is the inflammation of the eyelid is called as in medical term? We will see here options. Option A, ptosis. Option B, conjunctivitis. Option C, retinitis. Option D, blepharitis. Here option A, what is ptosis? Ptosis is also called as drooping eye. Abnormal low-lying or drooping upper lid is called as ptosis. Next option B, what is conjunctivitis? Conjunctivitis also called as pink eye. Inflammation or infection of the outer membrane of the eyeball and inner eyelid is called as conjunctivitis. Next option C, what is retinitis? Retinitis is an inflammation of the retina which can cause permanent vision loss. So retinitis means inflammation of the retina. Next option D, what is blepharitis? Blepharitis is an inflammation of the eyelid that affects eyelashes also. So here we got a answer. Inflammation of the eyelid is called as blepharitis. Option D is the correct answer. In detail we will see what is blepharitis. So here blepharitis is an inflammation in the oil glands of the eyelid. It causes swollen eyelids and crusting around the eyelashes. Even after it's treated and goes away, it can often come back again and again after the few years. Blepharitis, they may have red, puffy or crusty eyelids and sometimes red eyes. It may affect people of all ages. Blepharitis can lead to recurrent bouts of pink eye or conjunctivitis. In case we are not treating blepharitis in time, it can lead to conjunctivitis. So here inflammation of the eyelid is called as blepharitis. Option D is the correct answer here. Next we will move on to question number 22. From the following, which is not transmitted mainly by fecal-oral route? Fecal-oral route. From the following option, one is not transmitted through the fecal-oral route. We will see here options. Option A, hepatitis A. Option B, cholera. Option C, measles. Option D, enteric fever. We will see one by one. Option A, hepatitis A. Hepatitis A is highly contagious short-term liver infection caused by the hepatitis A virus. It mainly caused by the orophycal route of contamination. So hepatitis A is a fecal-oral route contamination. Next we will see option B, cholera. Cholera is an infectious disease that may lead to severe watery diarrhea which can lead to dehydration and even death if untreated. So this is also one of the fecal-oral route. Next option C, measles. Here we will discuss related to the measles. Measles is an airborne disease characterized by a virus and it is contagious in nature. Measles is an acute viral respiratory illness which is characterized by a prodrome of high-grade fever and malaise, cough, conjunctivitis. The symptoms may develop 8 to 12 days after exposure. The incubation period for the measles is 11 to 12 days. So here measles is an airborne disease. So here option measles is the correct answer. C is the correct answer. Option D, enteric fever. Enteric fever is also known as typhoid fever, is an infection that causes diarrhea and a rash. It is most commonly caused by bacteria is Salmonella typhi. The bacteria spreads through the contaminated food, drink or water. So this is also one of the fecal-oral route. So here from the following, which disease is not transmitted mainly in fecal-oral route is option C, measles is the correct answer here. Next we will move on to question number 23. The height of neonates will doubles by. The height of neonates will double by. We will see here options. Option A 4 years, option B 6 years, option C 3 years, option D 2 years. In general, length in full-term infants increases about 30% by age of 5 months and more than 50% by age of 12 months. The height doubles between the age of 4 years old. So here option A is the correct answer. In some books we are having it will be 5 years, but the normal height of neonates will doubles by the option A 4 years. Here option A is the correct answer. Next we will move on to question number 24. National Child Labour Policy amended in which year? From the option which year the National Child Labour Policy is amended. Here we will see options. Option A 1984, option B 1967, option C 1987, option D 1980. The National Policy on Child Labour August 1987 contains the association plan for tracking the problem of child labour. This act prohibits employment of children below the age of 14 years in 18 occupations and 65 processes. In Article 24 of the Indian Constitution clearly states that no child below the age of 14 years shall be employed to work in any factory or mine. So below 14 years child should not do a employment or any work till the age of 14 years. So here in the option C 1987 is the correct answer. The National Child Labour Policy amended in 1987. Next we will move on to question number 25. Neonatal mortality rate is equal to. What is the equal for the neonatal mortality rate from the options? Option A children about 28 days, option B children under 1 year, option C children under 28 days, option D children above 1 year. The number of deaths during the first 28 completed days of life per 1000 live births in a given year of other period. So here option C. Actually, what is neonate? Neonate means under the 28 days children's babies will called as neonate period. This is the 28 days. First 28 days period is called as neonatal period. So here neonatal mortality rate is equal to here option C children under 28 days is the correct answer here. So what is the calculation of neonatal mortality rate? The calculation of the NMR is number of resident neonatal deaths divided by number of resident live births into 1000. The causes of the neonatal mortality rate is preterm births, intrapartum related to complication, infections and birth defects are leading causes of the most neonatal deaths. So here option C is the correct answer. Next we will move on to question number 26. Tear glands do not develop until the age of. The tear glands will not develop until the age of from the options. Option A 6 months, option B 4 months, option C 2 weeks, option D 4 weeks. The newborns typically won't shed any tears because their tear ducts are still developing after the birth. Most babies start crying tears around 2 weeks of age, but some little ones can take longer to develop the ducts, usually by the age of 2 months. So here newborns start making more tears once their lacrimal glands are fully developed. So here the tear glands do not develop until the age of 2 weeks. Here option C is the correct answer. Next we will move on to question number 27. When DPT first dose and booster dose given? Here we can see in this question we covered two questions. What is DPT first dose and booster dose? We will discuss now options. Option A, at birth and 6 months. Option B, 8 weeks and 1 year. Option C, 6 weeks and 16 to 24 months. Option D, 10 weeks and 3 years. The baby shot or DPT contains vaccines against whooping cough, tetanus and diphtheria. What is DPT? Here in this question DPT is the DPT means diphtheria, pertussis and tetanus. So here the baby shot or DPT contains vaccine against whooping cough, tetanus and diphtheria. The recommended DPT series is in 5 doses we are having in immunization schedule. Administered at the 2, 4 and 6 months, 15 through 18 months and 4 through 6 years. Administer the 4th dose of DTP no earlier than 6 months after the 3rd dose. So here the first dose is in 6 weeks and the booster dose given in 16 to 24 months. So here option C is the correct answer. Next we will move on to question number 28. What is Erythroblastosis palsy? ERB'S. What is Erythroblastosis palsy? We will see here options. Option A, C2 and C3. Option B, C5 and C6. Option C, L2 and L3. Option D, L3 and L4. Erythroblastosis palsy. Erythroblastosis palsy is a paralysis of the arm. So here the Erythroblastosis palsy will affect the arm caused by the injury to the upper arm or upper group of the main nerves supplying it, specifically the upper trunk C5 to C6 of the brachial plexus. The signs and symptoms of the Erythroblastosis palsy will be related to the one arm only. These all are the signs and symptoms related to the one arm. Loss of feeling in one arm, partial or total paralysis to the one arm, weakness of one arm and numbness in the one arm, limited movements in the one arm. So here Erythroblastosis palsy will be affect one arm and the upper trunk area C5 to C6, and here option B is there, C5 and C6 of the brachial plexus will affect. So here option B is the correct answer. In most cases full recovery occurs within the first 2 to 3 months of the children's period. In every out of 1,000 children, in one baby is born with Erythroblastosis palsy. Here I didn't mention correct answer here. Just write down friends. Here option B, C5 and C6 is the correct answer. Next we will move on to question number 29. Grunting respiration in a newborn is suggestive of. Here the newborn is taking respiration like grunting. The grunting respiration in a newborn is suggestive of. We will see here option. Option A, respiratory failure. Option B, metabolic acidosis. Option C, alkalosis. Option D, meconium aspiration syndrome. When a newborn breathes a mixture of meconium and a amniotic fluid into the lungs. So here the newborn breathes a mixture of meconium and a amniotic fluid into the lungs around the time of delivery. So here meconium aspiration syndrome. Meconium aspiration syndrome is leading cause of severe illnesses and death in newborns, occurs in about 5% to 10% of all births in with the cause of meconium aspiration syndrome. The signs and symptoms of meconium aspiration syndrome is rapid breathing, retractions, grunting sounds with breathing and bluish color and low Apgar score in the baby. Here grunting respiration in a newborn is suggestive of meconium aspiration syndrome. Here option D is the correct answer. Next we will move on to question number 30. Children with symptomatic HIV infection should be given all vaccine except. So here the child is symptomatic to the HIV infection. The nurse or we should have to give all vaccines except from the options. Option A DPT, option B BCG, option C OPV, option D MMR. According to GACVS. What is GACVS? GACVS means Global Advisory Committee on Vaccine Safety. Concluded that the findings indicated there is a high risk of disseminated BCG disease developing in HIV infected infants, and therefore BCG vaccine should not be used in the children who are known to be HIV infected. So here in this question, children with symptomatic HIV infection should be given all vaccine. From the options we can give DPT, OPV, MMR, but except from the options we have to hold the BCG vaccine to the infected HIV infected symptomatic children. So here option B is the correct answer. Next we will move on to question number 31. Natural milk, poor source of the which nutrients? Here in the natural milk, the poor source of the which nutrients from the options? Option A protein, option B fat, option C calcium, option D vitamin C. And comparing the composition of milk nutrients, we understand food that the vitamin C is the poor source of milk. So here in these options, natural milk poor source of nutrients is vitamin C. Option D is the correct answer. What nutrients are naturally in milk? What will included in the milk naturally? We will see here source of calcium. Vitamin B2 is called as riboflavin. Vitamin B12 is also called as cyanocobalamin, and the natural milk is having source of potassium, phosphorus and vitamin A and vitamin D. The poor source of vitamin C, here option D is the correct answer. Next we will move on to question number 32. Involuntary movements of muscles. Means the involuntary movement of muscles is called as. We will see here options. Option A pica, option B tics, TICS, option C enurosis, option D encopresis. We will see one by one. What is pica? Pica means pica is a eating disorder. What is tics? Tics means is a involuntary movements of the muscles. So here option B is the correct answer. We will see what is enurosis. Enurosis means involuntary or urine incontinence. So here option C we got. Option D encopresis. Encopresis means fetal incontinence. So here option B involuntary movement of the muscles is called as tics. What is tics? In detail we will see now. Tics is a sudden twitches, movement or sounds that people do repeatedly. People who have tics cannot stop their body from doing these things. So here for example for the tics, a person might keep blinking over and over the eyes. So here it is the tics is not a psychological problem. This is the neurological problem. Involuntary movements in the muscles. Option B tics is the correct answer here. Causes for the tics due to the changes in the parts of the brain that control movement, and ages will be 5 to 10 years is the most occurrent age for the tics. So here option B is the correct answer. Tics, involuntary movement of muscles is called as tics. Next we will move on to question number 33. Abnormal connection between the trachea and esophagus. So here the abnormal connection between the trachea and esophagus is from the options. We will see here options. Option A esophageal atresia, option B pyloric stenosis, option C tracheoesophageal fistula, option D none of the above. What is option A? Esophageal atresia. Esophageal atresia is a birth defect and birth defect of the swallowing tube connects the mouth to stomach. So here abnormal connection between the trachea and esophagus, not option A. Next, option B. What is option B? Pyloric stenosis. The pyloric stenosis is a gastric outlet of obstruction. So the obstruction in the gastric wall. So here option B is not here. So what is tracheoesophageal fistula? The abnormal connection between the esophagus and trachea is called as tracheoesophageal fistula. The tracheoesophageal fistula is an abnormal connection between the esophagus and trachea. The condition tracheoesophageal fistula is an often congenital, which means it happened during fetal development. The tracheoesophageal fistula may also be acquired in adulthood due to the cancer, infection or trauma. The treatment involves surgery to close the fistula. So, signs and symptoms for the tracheoesophageal fistula in the children's: coughing or choking, drooling from the mouth, vomiting, difficulty breathing while feeding. So here in the option C is the correct answer. Abnormal connection in between the trachea and esophagus is tracheoesophageal fistula. Next we will move on to question number 34. Splints and braces are used in cerebral palsy to improve. So while using the splints and braces are used in the cerebral palsy for improvement of, what are the improvement we will get through the splints and braces while using these things? We will see here options. Option A, muscle weakness. Option B, muscle strength. Option C, numbness. Option D, irritation of muscles. Splints and braces are flexed to immobilize musculoskeletal injuries and support healing and prevent further damage. And also the child will have a stable basis for movement where they would develop higher level of functioning, including joints, range of motion ROM, muscle strength, fitness and endurance, balance and control over spastic movements. So here we got muscle strength and muscle fitness. So here option B is their muscle strength. Splints and braces are used in the cerebral palsy to improve the muscle strength. Here option B is the correct answer. Next we will move on to question number 35. The pediatric drug dose can be calculated based on. For the pediatrics we are giving drugs. The drug dose will calculated based on. We will see here options. Option A, based on disease condition. Option B, direct administration. Option C, body surface area. Option D, all of the above. The pediatric patient also have different proportion of fat, body, water and muscle compared to adults. Many pediatric doses are based on the child's age or weight. It is important to check close calculation. The calculated childhood dose should not be usually exceed the adult dose. So here the pediatric drug dose can be calculated based on from the options. Option C is the correct answer, body surface area. Here we are having 4 methods used in calculating pediatric doses. We will see one by one. Nomogram method. Through the body surface area and age we can give nomogram method. Next, second method is Friend's rule. What is Friend's rule? Friend's rule means using the child's age in months. By the child age in months we can use the Friend's rule. Next, third method is Young's rule. Young's rule means child age in years. Next, fourth method is Clark's rule. The Clark's rule is weight in pounds. Not only 4 methods, additionally we are having one thing in case of burns. The Parkland's burn formula we can use through the children's through this Parkland's burn formula, we can give pediatric drug doses. But normally pediatric drug dose based on the calculation of the basic body surface area and age. Here option C is the correct answer. Next we will move on to question number 36. Herland patches is most frequently associated with. What is Herland patches? The Herland patch is most frequently associated with which condition? We will see here options. Option A, psoriasis. Option B, rubella. Option C, erythema. Option D, pityriasis rosa. Option D, pityriasis rosa. Here what is Herland patch? Herland patch is an erythematous and viral infection. Most Herland patches appear on the trunk, neck or proximal extremities, although in rare cases they have appeared on the face, genitalia, scalp and acral surface. So, Herland patch mostly associated with pityriasis rosa. Here option D is the correct answer. The Herland patch most frequently associated with pityriasis rosa, a skin rash that sometimes begins with a large spot on the chest, abdomen or back, followed by smaller lesions. The signs and symptoms of the pityriasis rosa is skin rashes, skin redness and scaly rashes. So here option D is the correct answer. Pityriasis rosa is the correct answer. Next we will move on to question number 37. Which of the following disorders leads to cyanosis from deoxygenated blood entering the systematic arterial circulation? So from the following option, disorders leads to cyanosis from the deoxygenated blood entering to the systemic circulation, arterial circulation. We will see here options. Option A, aortic stenosis. Option B, TOF, tetralogy of Fallot. Option C, PDA, patent ductus arteriosus. Option D, none of the above. What is aortic stenosis? Aortic stenosis means narrowing of the valve in the large blood vessels of the heart. What is TOF, tetralogy of Fallot? Tetralogy of Fallot is a cardiac anomaly that refers to a combination of 4 related heart defects that commonly occur together, and the tetralogy of Fallot causes low oxygen levels in the blood. So here, if in case of low oxygen levels in the blood means automatically cyanosis will happen. So here from the options, following disorders leads to cyanosis from the deoxygenated blood entering to the systemic circulation is option B, tetralogy of Fallot is the correct answer. Here option C, what is PDA? PDA means a heart defect characterized by problem in the heart development. So here option B, tetralogy of Fallot is the correct answer. Tetralogy of Fallot due to the low oxygen levels in the blood, the causes of low oxygen levels in the blood, this leads to cyanosis. It happens when the baby's heart does not form correctly as the baby grows and develops in the mother's womb during the pregnancy itself. It will be happen. So here option B, TOF is the correct answer. Next we will move on to question number 38. In the following which is a hereditary hemolytic anemia? Here from the option, one is the hereditary hemolytic anemia. We will see here options. Option A, megaloblastic anemia. Option B, aplastic anemia. Option C, thalassemia. Affected population, that most common form of hereditary non-spherotic anemia. What type of anemia are hereditary means? Sickle cell anemia, thalassemia, congenital pernicious anemia and Fanconi anemia, thrombocytopenic purpura. So here these all are things hereditary anemias. Here hereditary hemolytic anemia is from the options. Thalassemia is the correct answer. Option C, thalassemia is the hereditary hemolytic anemia. Option C is the correct answer. Next we will move on to question number 39. What is anthropometry? What is anthropometry means? We will see here options. Option A, measures height and weight. Option B, head and chest circumference. Option C, mid or circumference. And option D, abdominal girth. Anthropometry is used as a proxy measures of body composition. For example, muscularity, fat-free mass and fat mass. Anthropometry is assessing the shape of upper arm in both clinical and field settings. Arm anthropometry includes upper arm length, mid upper arm circumference. It has been used for monitoring the nutritional status of patients in emergency situation. Here option C, anthropometry is used for the mid arm circumference. Option C is the correct answer. Next we will move on to question number 40. What is the nurse patient ratio of pediatric ward? We will see here options. Option A 1:4, option B 1:6, option C 1:1, option D 1:3. The nurse patient ratio in a critical care unit must be 1:2 and nurse patient ratio in an emergency department must be 1:4. These nurse patient ratio recommendation by a National Nurses United report but nowadays nurse patient ratio can fall simultaneously one staff nurse for or one nursing staff for every 6 beds. But according to National Nurses United reports, the nurse patient ratio of a pediatric ward is 1:4. Option A is the correct answer here. Next we will move on to question number 41. Erythroblastosis fetalis is also called as. What is erythroblastosis fetalis is called as? We will see here options. Option A anemia, option B hemophilia, option C Rh isoimmunization, option D leukopenia. Here what is erythroblastosis fetalis? Erythroblastosis fetalis is a hemolytic means breaking down of red blood cells. What is erythroblastosis? Erythroblastosis means making immature red blood cells. Here what is fetalis? Fetalis means fetus. So erythroblastosis fetalis means making immature red blood cells in the fetus. The condition involves a component of blood called as Rh factor. Rh isoimmunization is a preventable disease in which an Rh negative mother develops antibodies against prenatal Rh antigen on fetal RBCs. So here erythroblastosis fetalis is also called as Rh isoimmunization. Option C is the correct answer here. Next we will move on to question number 42. Stranger anxiety is an infant starts at. The stranger anxiety is in infants start at which age? We will see here options. Option A 8 to 12 months, option B 6 to 9 months, option C 4 months, option D 14 months. The stranger anxiety. What is stranger anxiety? Stranger anxiety is manifested by crying when an unfamiliar person approaches the baby. So, in case of unfamiliar or unknown person will approach the baby means the baby will start crying. This is called as stranger anxiety. It is normal when it starts at about age of 8 to 9 months. Usually about by age of 2 years. So here the stranger anxiety in infants start in 8 to 9 months of age and it will be stopped by the age of 2 years. Stranger anxiety is linked with the infant's developmental task of distinguishing the familiar from the unfamiliar. Stranger anxiety is not an abnormal thing. Stranger anxiety is a perfectly normal developmental stage that often begins around the 6 to 8 months. So here option B 6 to 9 months we got a answer. Option B is there here, but actually 6 to 8 months is the correct answer. So next we will move on to question number 43. Temporary teeth consist of. The temporary teeth is consist of, we will see here options. Option A, 4 incisors, 4 molars, 4 canines in each jaw. Option B, 2 incisors, 4 molars, 4 canines in each jaw. Option C, 4 incisors, 2 molars and 2 canines in each jaw. So, option D, none of the above. So, here the temporary teeth is consist of from the following is option A is the correct answer. In each arch of the mouth there is 2 central incisors and 2 lateral incisors. So, we are having 4 incisors. Next, totally 4 incisors, 2 canines and 4 molars in each jaw. When the permanent teeth start growing, the temporary or premolars teeth will fall off. So here the temporary teeth is consist of 4 incisor, 4 molars and 2 canines in each jaw is the correct answer, option A. Next we will move on to question number 44. According to moral theory, toddler responds to from the options dash and dash. According to moral theory, toddler will respond from the options. Option A, love and affection. Option B, anxiety and fear. Option C, punishment and reward. Option D, hatred and fear. The moral development refers to the process through which children develop standards of right and wrong within their society based on social and cultural norms and laws. In moral theory, we are having 3 stages of moral development in the toddlers. We will see the 3 stages in moral theory. The moral theory is having 3 stages. First one is pre-conventional stage, second one is conventional stage and third one is post-conventional stage. In first stage, pre-conventional stage, morality is extremely controlled and also conformed to in order to avoid punishments and they will receive the rewards. So here according to moral theory, the toddler responds to option C is the correct answer. The toddler will respond to punishment and rewards. So here option C is the correct answer. Next we will move on to question number 45. The birth weight will quadruple by. The birth weight will quadruple by. We will see here options. Option A 5 months, option B 18 months, option C 2 years, option D 1 year. Here quadruple means not doubles, not triples. 4 times is in according to the birth weight. By birth weight is 4 times will be extra. We will see what is the quadruple age from the options. An average baby's weight will roughly quadruple by the time they are about 2 years and 2.5 years of old. The weight usually doubles by the about 5 months of age and triples by 12 months of age and quadruples from the 2 to 2.5 years of age based on the weight of the birth. Weight of the birth. So here birth weight will quadruple by the age of 2 years. Here correct answer. Next we will move on to question number 46. A child diagnosed with Kawasaki disease. Apart from the identified symptoms of the disease, not included identified symptoms of the disease, the child may also likely develop which of the following symptoms. Here, apart from the identified symptoms of the disease, a child may also likely develop from the options. We will see here option A sepsis, option B meningitis, option C aneurysm formation, option D mitral valve disease. Here, what is Kawasaki disease? Kawasaki disease is also called as mucocutaneous lymph node syndrome, and Kawasaki disease is a condition that causes inflammation in the walls of some blood vessels in the body, most common in infants and young children. Kawasaki disease is an acute vasculitis of childhood that leads to coronary artery aneurysm. So, here option C aneurysm formation is the correct answer here. The Kawasaki child is diagnosed with Kawasaki disease, apart from the identified symptoms, the child may be likely develop aneurysm formation. Aneurysm formation in 25% of cases are untreated. The aneurysm formation is a bulge in the wall of an artery. Aneurysm form when there a weak area in the artery wall. The aneurysm will form a formation when the weak area in the artery wall. So here option C, aneurysm formation, is the correct answer. Next we will move on to question number 47. Increased growth hormone in children will cause. So the children is having increased growth hormone. So the children will cause. We will see here options. Option A, acromegaly. Option B, gigantism. Option C, dwarfism. Option D, cretinism. Here, due to the increased growth hormone, acromegaly and gigantism are the disorders of increased growth hormone or hypersecretion of the growth hormone. The most common cause is a growth hormone secreted adenoma in the pituitary gland. Growth hormone or increased growth hormone is cause of gigantism. Gigantism occurs in patient who had excessive growth hormone in childhood. It can lead to many changes in the body. So here increased growth hormone is in children will cause the gigantism. Option B is the correct answer. Next we will move on to question number 48. Kyphosis in children is due to. What is kyphosis? Kyphosis in children due to, we will see here options. Option A, rickets. Option B, infection. Option C, genetic. And option D, paralysis. Kyphosis is usually refers to an abnormally curved spine. Causes for the kyphosis: poor posture in the childhood, such as slouching, leaning back in chairs, and carrying heavy school bags. And kyphosis in children's prenatal or perinatal diet deficient in the vitamin D. Due to the vitamin D, the child will get rickets. Kyphosis also called as hunchback. Kyphosis is also called as hunchback. The kyphosis in children is due to the rickets. Through the rickets, the child will get kyphosis. Kyphosis means abnormally curved spine. So here option A is the correct answer. Next we will move on to question number 49. A child is diagnosed with Williams tumor. During the assessment, nurse have to assess except. So here the child is having diagnosed with Williams tumor. During the assessment, nurse have to assess except from the options. We will see here options. Option A, dysuria. Option B, an abdominal mass. Option C, hematuria. Option D, nausea and vomiting. The most common sign of Williams tumor is a painless and palpable abdominal mass, sometimes accompanied by an increase in abdominal girth. So here the except, nurse have to assess the abdominal mass. Here option C is the except. Why means if the nurse is palpating the abdominal mass means there is no painless, because Williams tumor means painless tumor. So through the palpation of the abdominal mass we can't detect the condition. So here option B, abdominal mass, we have to accept the options here. Option A, dysuria and hematuria, nausea and vomiting. These all are the condition. These all are the signs and symptoms are the common in these conditions. And nausea and vomitings are rare in children with Williams tumor. So here option B is the correct answer. Next we will move on to question number 50. Which of the following fontanelle will closed first in children's? So the first fontanelle will closed in the children. We will see here options. Option A, sphenoid. Option B, occipital. Option C, mastoid. Option D, frontal. Babies are usually born with 6 fontanelles. There are in different places around the skull and close at different times throughout childhood. The posterior fontanella usually closed first, followed by the sphenoidal fontanelles, moster fontanelles and anterior fontanelles. So here from the options, from the following fontanelles will close first in children is occipital fontanella will close first in children. So here option B is the correct answer. This is the last question in this video. This is the part 2 from the child health nursing. We already discussed in part 1 20 question. This is continuation part from the part 1. This is part 2. I will keep the part 1. I will mention in description also. I will give a link in description. This is part 2. Now we finished till 50 question. We finished in part 2 and part 1 continuous. Next we will continue from the 51 question. From the 51 question we will discuss in part 3 video. Thank you so much for watching my video. Please subscribe my channel. Click on the bell icon for further notification. Please share your opinion in comment section. Give a like and stay tuned friends.